All right, let's talk about chapter 24, hematologic and renal emergencies. This is a relatively short section, and we'll talk about the hematologic system and the renal system. The hematologic system is made up of blood. It represents its own organ system, has specific functions, and you may need to know for test questions some of the functions of the blood, okay? So it's used to control the bleeding by clotting, delivers oxygen to the cells, it removes carbon dioxide from the cells, and the removal of delivery and other waste products to organs to filtrate and remove them. Okay, blood's made up of solid components. It's made up of white blood cells, red blood cells, platelets, and it's suspended in a plasma. All right, medications can affect some components of the blood. So blood clotting, aggregation of platelets, is the body's most rapid and initial response to stop bleeding. So you get a cut, the platelets will aggregate, and they'll go to the site and they'll start to clot. Okay, clotting factors are a group of proteins produced in the liver and released into the bloodstream. Once activated, the clotting factors form clots through clotting cascades. Abnormal clotting of the blood. So these are coagulopathies. They can occur when the body forms clots too readily or patient clots too slowly, okay? Certain diseases make patients prone to poor clotting, like advanced liver disease, hemophilia, von Willebrand disease, okay? So coagulopathies can occur when the body forms a clot too readily. So you can form clots in your body when you're not supposed to be, and that can get lodged other places in your body. Or if it clots too slowly, when it needs a clot and you get a cut and it doesn't clot, then you can bleed out. And if it's internal bleeding, that can be very, very serious. Okay, so how do we identify patients with coagulopathies? Certain medical conditions, medications, in which the normal ability to form clots can worsen a patient's disease. Some patients can be prescribed blood thinners. They're not actually thinning the blood. What they're doing is they're making it more slippery, and they make it harder for the body to form clots. Okay, patients are more prone to have life-threatening bleeding when injured than patients not on these medications. That's because your body isn't able to clot very well. All right, we'll talk about anemia. Anemia is the lack of normal amount of red blood cells, okay? Acute anemia can happen when there's a sudden blood loss. So you lose a lot of those red blood cells. And then there's chronic anemia, could be caused from excessive menstrual periods, slow GI bleeding, so you're bleeding out into the body cavity and you're pooping it out essentially, or diseases affecting bone marrow. Okay, sickle cell anemia is a genetic disease that affects red blood cells. It's more prevalent in certain ethnicities like African Americans, Indians, Middle Eastern descent. Okay, they have a defective shape that resembles a sickle, which is where they came up with the name sickle cell anemia. And then the cells have a short lifespan, leading to anemia. Certain complications you can run into with a sickle cell anemia would be destruction of the spleen, sickle pain crisis, acute chest syndrome, priapism, stroke, jaundice. So the sickle pain crisis, you have these sickle cells, these red blood cells get caught up in the body somewhere, and it can actually just cause pain, okay? Priapism is an erection that doesn't go away. It's caused by no other reason you can think of. So priapism is something we can look for in our trauma patients with severe head injuries. If you see a man with an erection after a serious motorcycle accident, for example, okay, that can indicate some kind of serious head trauma. But in sickle cell, you can also see the priapism as well, because those red blood cells can get stuck in the penis and cause it to be hard and not go away because all those red blood cells, the sickle cells, are stuck. Okay, they say 1 in 12 African Americans has the sickle cell trait. But does not always lead to complications. So they can lead a normal life. They might have the trait, but it might not be affecting anything. Okay, so how do we treat patients with sickle cell if we need to bring them in? Oxygen used to kind of be the go-to for everything. And so that's why it says here, administer supplemental oxygen. We don't have to give oxygen to everybody, okay? But if they are having inadequate respirations, and they're showing signs of hypoxia, yes, of course, we're going to be giving oxygen. They monitor for signs of hypoperfusion, which is shock, and transport to a stroke center if the stroke is suspected. So those red blood cells, those sickle cells, are getting stuck in the brain now and causing a stroke. Okay, there's a video on sickle cell anemia I would encourage you all to look at. They're available online. All right, and then we'll talk about the renal system. The renal system is made up of the 2 kidneys, 2 ureters, and 1 urethra. And they're responsible for filtering the blood and removing waste. They also maintain a fluid balance and the acid-base balance. Okay, there's different diseases that affect the renal system. All right, they can affect different portions. They can range from minor to life-threatening. Urinary tract infections. Most common disease that afflicts renal and urinary systems, caused by bacteria, usually limited to the bladder, can cause pain and frequent urination. If left untreated, can result in pyelonephritis. Pyelonephritis is a fancy word for kidney infection, okay? Where the urinary tract infection ascends up the ureter into the kidney, okay? Kidney stones. Kidney stones are usually made of calcium formed within the kidney. When they're in the kidney, they cause no symptoms. We wouldn't even know that they're there. But when they become dislodged, they can cause unilateral flank pain that radiates to the groin area. And patients may report nausea and vomiting. So if one of those little kidney stones gets dislodged from the kidney and it gets stuck in the ureter, the unilateral flank pain is pain in their back, but it's kind of on one side, and that makes you suspicious of kidney stones. Okay, patients with urinary catheters, as a result of renal obstruction of bladder outflow. Could be a neurological disorder. Then they'll use urinary catheters to drain the urine. They're commonly inserted into the urethra and may be placed through the skin. Complications of the UTI and local trauma at the site of catheter insertion could be one of the issues that we come upon. Now, we're not going to do anything with catheters. We're not going to insert them. We're not going to remove them. But just be aware catheters are a thing and they exist, and there can be some complications with catheters. Okay, renal failure occurs when kidneys lose the ability to adequately filter and remove toxins. Acute failure typically results from shock or toxic ingestion. So if you're drinking gasoline, guess what's going to happen? You're probably going to end up in renal failure. Chronic failure may be inherited or secondary to damage from uncontrolled diabetes and hypertension. So real high blood pressure for a long time, uncontrolled diabetes for a long time can throw that high blood sugar. We talked about hyperglycemia. That can affect all your body systems real negatively, and it can mess with your kidneys, okay? End-stage renal disease, ESRD, is irreversible renal failure. It requires dialysis. And there's 2 different kinds of dialysis. There's hemodialysis and peritoneal dialysis. We'll talk about both of those in just a second so you have an idea of what they are. 90% of people receive hemodialysis in specialized centers. That's when you go to the hospital 3 days a week or whatever it is, and they hook up to you and they'll filter your blood out for you, and then you go home. Okay, peritoneal dialysis can be done at home. More than 400,000 Americans on dialysis who are treated in dialysis centers undergo 3 treatments a week, lasting 3 to 4 hours. Only 8% treat themselves at home. ESRD patients often rely on EMS for transport to and from dialysis. Now, if somebody calls you and needs a ride to dialysis, guess what? That's a call for service, and you have to take them. But generally speaking, these people have arrangements for transportation figured out. Okay. Hemodialysis, patient is connected to a dialysis machine that pumps blood through specialized membranes. Treatments last several hours, multiple times per week. So we see a little diagram here, and they connect your body to one side of your artery and your vein, and they connect through, and they pump and they filter your blood and they put it back into your system, and then you're good to go home for a couple of days. Okay. There's two types of access to blood circulation: two-port catheter and AV fistula. Characteristic thrill when palpated. Usually what we see is that AV fistula, and I think there's a picture in here. If there's not, I would encourage you to look one up so you know what they look like. And it's very important that if a person's on dialysis, you do not take blood pressure from that arm where they have the AV fistula. If you damage that fistula, one, it will bleed out very quickly, because this is an artery and a vein put together. So you have a lot of blood going through that site. And if you damage that site, that person is going to start dumping blood everywhere. And you don't want, you put a tourniquet on it, you're probably going to have to, but then you destroyed that site and they need to get a new AV fistula put in after. And the whole process is horrible. So never, never, never take a blood pressure on the same arm as an AV fistula. Generally speaking, when I'm taking vital signs from a patient, even if I don't suspect they're on dialysis, is it okay to take a blood pressure on this arm? And they'll tell you, yes, this one's good. No, this one's not good, for whatever reason. Okay. This is an example here of a two-port catheter. I don't see these quite so much, but they exist. I'm not saying they're not out there. And that is a fistula. So this is basically, they take an artery and a vein and they connect them together and they make an access port, and then that'll allow them to run the dialysis. Okay, and then there's peritoneal dialysis. It uses the peritoneal cavity's large surface area. Special fluids infused into the abdomen cavity and left for several hours to absorb waste and excess fluid. The fluid is then removed and discarded. Okay. Continuous ambulatory peritoneal dialysis. Gravity exchange process repeated several times a day. So these are two different kinds of peritoneal dialysis. You don't need to know every detail about these things. Know that they exist. These aren't machines or things that we're going to be messing with. But these are things you might come across with your patients. You should know a little bit about them, okay? And then there's CCPD, Continuous Cycler Assisted Peritoneal Dialysis, which is a machine that's used to fill and empty the abdominal cavity while a person sleeps. So there's a couple different ways that you can do the peritoneal dialysis, all right? And there's a picture right there. Pretty simple, all right? Medical emergencies we might run into with the end-stage renal disease, okay? Two broad groups: loss of normal kidney function, complication of the dialysis treatments. Most dialysis patients have underlying medical factors like diabetes and hypertension that we already talked about. And complications continued usually relate to a patient missing dialysis. They present with signs and symptoms similar to congestive heart failure, like shortness of breath, edema, which could be in their feet, could be in their lungs. Okay, the fluid's backing up into their system somewhere, and electrolyte disturbances. Patient care. So for the ESRD patient who has missed dialysis, assess their ABCs, and that's it with every single patient you're ever going to see. Obtain vital signs and be aware of fistulas like we talked about. We do not want to take a blood pressure on the same arm as a fistula. Administer oxygen if necessary. Monitor vital signs closely and have an AED ready just in case, and transport to the facility capable of dialysis. So it's very important that these people are on schedule for their dialysis, and if they miss it, it can be fatal. All right. Complications: bleeding from the AV fistula site, clotting and loss of function of the AV fistula, bacterial infection of blood due to the contamination of the AV fistula or dialysis catheter site. Okay, so we might see if the AV fistula gets messed up and it starts bleeding. Okay, it can be very serious. Like I said before, that there's a lot of blood flowing through that site right there. Or there could be an infection, whether it be in the catheter site or the fistula itself. Okay, so any patients with complications of dialysis, assess their ABCs and control bleeding. Okay, this is important. Control bleeding. So use direct pressure elevation. Okay, we don't really do the elevation anymore. And hemostatic dressings as needed. We are allowed to use hemostatic dressings in our region, okay? But direct pressure will be the first one you go to. If it can't be controlled by other means, a tourniquet should be applied. just know that if you apply that tourniquet, you're probably going to destroy that AV fistula site. Now, of course, we have to stop the bleeding, so we're going to do what we have to do to stop the bleeding. But if it's minor, don't go right for the tourniquet. If it's major bleeding, you can go right for the tourniquet, all right? And administer oxygen if necessary. Treat for shock, keep the patient supine and warm. Again, if they bled, if they lost a lot of blood, they could be going into shock. If peritonitis is suspected, transport dialysis fluid for confirmation. So if they have the fluid nearby in their machine and it's in a little plastic container, you could bring that up, and then the hospital can check it out and see what's going on. Kidney transplant patients. Kidneys are the most commonly transplanted organ. That may be a test question. There's approximately 16,000 transplants per year. Patients spend their lives on special class of drugs to help prevent organ rejection and increase susceptibility to, they have an increased susceptibility to infections. Okay. All right. There's a video on renal failure I would encourage you guys to take a look at. We'll do a quick review. Blood delivers oxygen to the cells, removes carbon dioxide from the cells, and controls bleeding by clotting. This may be a test question. They want to know if you know the functions of blood. Blood contains red cells, white cells, and plasma. And anemia is a lack of red blood cells in circulation. Sickle cell anemia is an inherited disease in which a defect in the hemoglobin results in sickle's shape to red blood cells. This mishappening inhibits movement of red blood cells through capillaries, causing sludging and blockages in smaller blood vessels. The renal system is comprised of the kidneys, the ureters, the bladder, and the urethra. Kidneys perform vital filtering of the blood to remove waste products. They also help maintain water balance within the body. Problems with the renal system include infection, kidney stones, and renal failure. Renal failure is a condition in which the kidneys are unable to filter waste and provide a balance of fluids and electrolytes in the body. Dialysis removes excess fluid and electrolytes from the body by filtration. Dialysis may be performed in either of two ways. Hemodialysis, remember that's the one that they go to the facility and get the dialysis done, or peritoneal dialysis. Right? Peritoneal dialysis is done at home and is usually done several times a day. Major complications in patients with end-stage renal disease can occur after the patient has missed a dialysis appointment, infections, or as a result of bleeding from hemodialysis access sites. So again, these people need to be on their schedule, otherwise it could be fatal. Remember, blood has specific cellular components. Abnormal blood cells can significantly affect patients. The renal system is critical to maintaining homeostasis. Renal failure can be chronic or acute. End-stage renal disease is managed through dialysis. Questions to consider. I want you guys to take a look at this in your books and the critical thinking. All right, that is it. And I will see you guys soon.